Chapter 2, Theories and Therapies. So the foundational theories provide an understanding and consideration of human growth and development, environmental adaptations, personality development, and it makes us ask, what is mental illness and how do mental illnesses develop? Mental health theories are foundational for understanding how and why patients act the way they do. These theories serve as a guide to explaining, predicting, and understanding the phenomenon of disconcerting behaviors that are related to mental illness. So, Sigmund Freud. Freud believed that the majority of mental health disorders were due to unresolved issues that originated in childhood and influence our adult lives. Freud suggested that adulthood behavior is based on nurture, what someone is born with, which is heredity, and nurture, the way someone is raised, that is learned. Freud believed there were 3 levels of psychological awareness, which include the conscious, preconscious, and unconscious. Conscious is just the tip of the iceberg. It's what a person is aware of at any time. Preconscious is just below the surface of awareness, and information can be easily retrieved. And finally, we have the unconscious. This is deep below the surface. These are repressed memories, unacceptable urges, and trauma, and we are unable to retrieve this without assistance. The unconscious exerts a powerful yet unseen effect on the conscious thoughts and feelings of a person. Freud also believed that there were 3 systems of the personality: the id, the ego, and the superego. Now, the id helps determine a person's personality and how they interact with the world. It is unconscious and it is impulsive. It encompasses all drives, instincts, and reflexes. And it includes something like instant gratification. It is illogical and it lacks problem solving. Think about a hungry, crying infant. Instant gratification. As soon as you give them that bottle of milk, food, whatever the case may be, they instantly stop crying. Ego helps determine a person's personality and how they interact with the world. Ego becomes a problem solver and cultivates defense mechanisms, is a reality tester, and navigates the outside world through conscious, preconscious, and unconscious levels of awareness to implement plans to decrease stress. The superego is concerned with morals and following the rules. It forms a sense of pride or guilt. In a healthy and well-adjusted adult, all 3 of these are balanced, with ego taking the lead. Defense mechanisms take action when the unconscious assists the ego in dealing with threats, whether internal or external, that cause a state of anxiety. They deny, falsify, or distort reality to make it less threatening, and they ward off anxiety by preventing conscious awareness of threatening feelings. Freud believed that experiences within the first 5 years of life shape the person's lifetime adjustment, coping patterns, and personality traits. You can review the stages on the table independently, and also can refer to the table 2.1 on page 20 of your textbook. So, classical psychoanalysis is seldom used because intra-psychic conflict is no longer thought to be the root cause of mental illness. Session tools: first is free association, encourages the patient to freely share whatever comes to mind. Dream analysis encourages patients to share dreams for symbolic analysis by a therapist. And defense mechanism recognition The therapist aids patients in recognizing and overcoming maladaptive defense mechanisms. Therapists would then make an educated guess on the interpretation of the dominant conflict. And as far as the concepts, you have transference, which is unconscious feelings that the patient has toward a healthcare worker that were originally felt in childhood for a significant other. For example, the patient may say, "You remind me of my mom." And this can be positive because maybe the mom was affectionate, or maybe it was negative because the mom was hostile. And then there's countertransference. It's the unconscious feelings that the healthcare worker has toward a patient. It can also be positive and negative, and it absolutely will affect how you act toward your patient. The psychodynamic therapy is a newer psychoanalytic model that focuses on the here and now. It uses many tools of psychoanalysts with clearly defined areas to concentrate on. The best candidates are the quote worried well, as they have a clear area of difficulty, they are intelligent, and they are well motivated for change. Those that have a severe mental illness, severe depression, psychosis, or personality disorders are not good candidates for this type of therapy. There is a rapid back and forth between the therapist and the patient. So the interpersonal theory is based on the concept, let me get just to it. The interpersonal theory is based on the concept that interpersonal relationships and social experiences assist in shaping an individual self with three different types: the good me, the bad me, the not me. The concept of good me versus bad me is often based on social assessment, and anxiety is anticipated where there is negative feedback. The not me is considered the unknown or the part of the individual that is often repressed. Sullivan believed that the purpose of all behavior is to get needs met through interpersonal interactions and to reduce or avoid anxiety. Early relationship with a primary parenting figure is crucial for personality development, according to Sullivan. Interpersonal therapy is most effective in treating grief and loss, interpersonal disputes, and role transitions. So interpersonal therapy focuses on interpersonal relationships and social interactions, including how much support you have from others and the impact these relationships have on your mental health. This type of therapy recognizes that a person's relationships and environment can have a huge impact on their mental health. Interpersonal therapy is most effective in treating grief and loss, interpersonal disputes, and role transitions. So Hildegard Peplau created the interpersonal relations model, which bridges theory and nursing practice. This model was based on the concept that nurses seek to understand their personal behaviors and the behavior of those around them to then apply the principles of human relations to one's needs. Peplau was the first to identify mental health nursing as crucial and the nurse-patient relationship as foundational to nursing practice. The focus became what nurses do with patients instead of what nurses do to patients. The nurse's role is to educate clients and assist them in developing effective interpersonal skills. We cannot isolate as nurses. We must interact with our patients. Well, according to Peplau, there are 4 phases. Pre-interaction prepares for the interaction data and history while anticipating concerns and performs a self-evaluation of feelings related to working with the patient. Orientation, the nurse explains their role and the patient expresses their needs. The goal is to develop a sense of belonging and relationship. Working phase, trust is established between the nurse and the patient who work together to achieve identified goals. In the termination phase, goals have been achieved and the nurse has provided all possible assistance. On page 2022, table 2.2 is a quick reference for other theorists. So Miss V is admitted to your unit after being picked up by police for intoxication and anxiety. After she is stabilized, she spends the rest of the night on suicide watch. In the morning, she is admitted for a stay of 3 to 5 days for evaluation. The police are not pressing charges for disturbing the peace because she has promised to get help. As you begin working with her, you notice Miss V has an uncanny resemblance to your younger sister. As a child, this sister lied and criticized you constantly, then screamed and cried to others if you challenged her. You realize that you are responding negatively to this patient. What is going on here? The answer is D, countertransference. These are unconscious feelings the healthcare worker has toward the patient. So what should you do? You should realize the importance of maintaining self-awareness and seeking supervisory guidance as the therapeutic relationship progresses. So behavioral therapy, Ivan Pavlov. Y'all have all heard of Pavlov. This is a classical conditioning theory in which he experimented with dogs, food, and bell ringing. Responses are involuntary, meaning they are not under a person's conscious control and are not spontaneous. For example, the one in the book says, a young boy got food poisoning after eating coleslaw, so later in life he became nauseated with the smell of coleslaw. Next is John Watson. This is based on behaviorism, which is the science of behavior that can be observed. Watson believed that personality, either adaptive or maladaptive, was socially learned through classical conditioning. Example, he would make a loud noise every time a 9-month-old child reached for a white every time a 9-month-old child reached for a white rat, which eventually caused a fear of white fur and hair in the child. And finally, B.F. Skinner believed that responses are voluntary based on learning that occurs through rewards or punishments. He developed a Skinner box to perform experiments with rats. And this is the Skinner box. So there's a little bit more we need to talk about. Under Skinner, there is reinforcement. It can be positive or negative, and it causes the behavior to occur more frequently. Punishment causes the behavior to occur less frequently. And extinction is the absence of reinforcement and decreases the behavior by withholding a reward that has become habitual. For example, ignoring a student's behavior in class who is acting out that was previously given attention. Behavioral therapy. So change can occur without focusing on the underlying cause. This type of therapy works best when directed at a particular problem, such as phobias, alcohol use disorder, and schizophrenia. Modeling. This is the desired behavior is modeled for the patient through role playing. Operant conditioning is positive reinforcement to increase the desired behaviors. It uses a token economy reward system. Exposure therapy is used for patients with anxiety related to fears, phobias, or traumatic memories. It encourages the person to face fears and process their emotions in a safe environment. Aversion therapy is a pairing of target behavior with a negative stimulus in order to extinguish undesirable behavior. It's used when other less drastic treatments were unsuccessful. Example, putting a bitter substance on a thumb to deter thumb sucking. And finally, biofeedback has been successfully used to control the body's physiological response to stress as well as anxiety. Cognitive theory is the dynamic interplay between individuals and their environment. Thoughts come before feelings and thoughts come before actions. Thoughts about the world and our place in it are based on our own unique perspectives, which may or may not be based in reality. So let's talk about cognitive therapy. Cognitive therapy is based on the concept that problems and distorted thought patterns cause negative emotions and can lead to maladaptive behaviors. Rational emotive therapy. The aim is to remove core irrational beliefs by helping an individual recognize thoughts that are not accurate, true, or useful. Beliefs that are negative and self-deprecating are more likely to lead to depression and anxiety. There is an ABC process of negative thinking. A is the activating event, B are your beliefs, and C is the emotional consequence. Next you have cognitive behavioral therapy. You'll just hear it called CBT. It's based on the premise that the patient's mental health problem is based in part on faulty thinking or unhealthy thoughts and on learned patterns of behavior. It is effective for things such as depression, anxiety, eating disorders, and learning to adapt with the tics from Tourette syndrome. Under CBT, we have schemas, which are unique assumptions a person has about themselves, others, or the world in general. We also have automatic thoughts, which are rapid, unthinking responses that are based on schemas. And finally, cognitive distortions, which are automatic thoughts that are irrational and lead to false assumptions and misinterpretations. So patients are taught to challenge their own negative thinking and substitute it with positive, rational thoughts. They learn to recognize when thinking is based on distortions and misconceptions. CBT therapy is working when thoughts change from things like, I always mess up when I cook lasagna, to sometimes I mess up when I cook lasagna, but I am learning. Table 2.3 here on page 27 is a really good one to look through. Now you also have trauma-focused cognitive behavioral therapy, which was recently developed in the 1990s and was originally for addressing sexual abuse in children, but it can be used for any person that has experienced severe trauma or abuse. This type of therapy helps to identify feelings, how to manage them, and then replace them with positive thoughts. And dialectical behavioral therapy. Dialectic is an integration of opposites. So this type of therapy was developed for those with behavioral disorders that involve emotional dysregulation. These strategies have been used successfully for patients that are chronically suicidal or self-injuring with borderline personality disorder. And on page 28, table 2.4, are comparisons of the different therapies. You will see these therapies throughout the entire semester, so it will be helpful to be very familiar with them. So the theory of human motivation is based on Maslow's hierarchy of needs. It states that human beings are active participants in life that are striving for self-actualization, which is the need for personal growth and development throughout one's life. When the lower needs are met, such as physiological needs, then the higher needs can then emerge. In other words, until we meet these physiological needs, food, water, oxygen, elimination, rest, and sex, it's hard to go up to our safety needs. And without meeting our safety needs, it's hard to meet our love and belongings needs, so on and so forth. So the biological model emphasizes that the brain plays a critical role in mental illness and aids to locate the imbalance in the body to target the sites of illness. Biological therapies. So we have pharmacotherapy. Psychopharmacology actually began in the 1950s with a potent antipsychotic called chlorpromazine, or also called Thorazine. There are many different medications used to treat mental illness today, which affect a variety of neurotransmitters and help restore brain function. Then you have brain stimulation therapies. This is electroconvulsive therapy. It is the oldest of this type of treatment, and it involves electrical stimulation of the brain. You can also refer to Table 2.5 on page 30 for some approved brain stimulation therapies. We will talk more about electroconvulsive therapy, also known as ECT, throughout the semester. So what are the implications for nursing? We need to use a holistic approach that includes physical care and effective communication, as well as building a therapeutic relationship with our patients. So you have your developmental theories, which are cognitive, and these were developed by Jean Piaget. This theory focuses on cognitive, intellectual development that processes from primitive awareness to complex thoughts and processes. According to Piaget, there are 4 stages. The first is the sensory motor stage. This is up to 2 years old, and these are basic reflexes, and they start to develop purposeful movement. Next is your pre-operational stage, which is ages 2 to 7 years old. This is concrete thinking that has developed, but it's not abstract thinking. At this age, they are very egocentric. Concrete operational is from 7 to 11 years old. This is the ability to problem solve due to abstract and logical thinking. They begin to classify based on characteristics or patterns, and they can see another person's point of view. And then you have your formal operational, which begins at 11 years old into adulthood. This is where we can think abstractly and can problem solve, and we develop conceptual thinking. Next is Erikson's theory of psychosocial development, which stemmed from Freud, but it emphasized the role of culture and society on personality development. The individual proceeds through a series of 8 stages on personality development. The individual proceeds through a series of 8 stages throughout the lifespan and involves becoming competent in each stage. The successful or unsuccessful completion of each stage will affect the person's progression to the next stage. You can see Table 2.6 on page 32 of your book for information on the various stages. So Mahler developed the theory of object relations, which stated that the main developmental task is differentiating between self and others. Mahler said that past relationships influence a sense of self and also present relationships. An object is considered a significant person in the child's life, and the child must have confidence and reassurance that the caregiver is present, or a disruption of early separation will occur. Sorry, that was that slide. I apologize. So Mahler. Moving on, theories of moral development. The goal of moral development is that an individual learns not to do wrong, but instead examines and does what is good for others. The theory is broken down into 6 stages within 3 separate levels. The pre-conventional level is typically from ages 4 to 10 years old. It is the first stage within this level is obedience and punishment, and the second stage is individualism and exchange. Next is the conventional level, is typically from 10 to 13 years old. The third stage is good interpersonal relationships, and fourth stage is maintaining social order. And finally is the post-conventional level, is adolescence and up. The fifth stage is social contract and individual rights, and the sixth stage is universal ethical principles. These are different stages within them, as you can see. The ethics of care theory. Gilligan worked with Kohlberg but wanted to include women and girls in the research. Morality of care replaced Kohlberg's justice view, meaning that we should do what is right no matter the personal cost. There are other theorists that you can refer to in Table 2.8 on pages 33 through 34. According to Freud, which aspect of the personality motivates an individual to seek perfection? The answer is C, superego. The superego represents the ideal rather than the real. It seeks perfection as opposed to seeking pleasure or engaging reason. A nurse is caring for a client who has a new prescription for disulfiram for treatment of alcohol use disorder. The nurse informs the client that this medication can cause nausea and vomiting when alcohol is consumed. Which of the following types of treatment is this method an example? A, aversion therapy. It pairs a maladaptive behavior with an unpleasant stimuli to promote a change in behavior. This is one of the first couple of drugs we've came up with. We've talked about chlorpromazine or Thorazine and now disulfiram. It would be helpful if you get a medication template and go ahead and fill those out for these two drugs.